problems now, and Britain's approach to dental care may be in need of serious and urgent attention itself, because a new survey has found, as well as not visiting the dentist often enough, many people fail to follow the most basic oral health recommendations. Joining us now in the studio, the Chief Executive of the British Dental Health Foundation, whose name I don't have. You are, sir. Sorry, I don't have. Nigel Carter. Thank you very much indeed. Nigel, judging by those findings, we mustn't be getting the education message right if people don't know how to do the basics.
I don't think we are getting the education message right. The survey that Extra have done there is particularly exposed in our teens the problems that we've got, with more than 40% of them actually saying that they only clean their teeth once a day. Nearly a quarter of them saying that they don't even clean once in a day.
Why is, I mean, I remember going back to primary school, it was always incentives about teeth. I mean, people would come and visit, dentists come and visit, you get little prizes and toothbrushes and all sorts of gimmicks to encourage you to do these things. What's changed today?
Well, I think the younger children, we probably get and we're okay. It's when they get into their teens, less parental control. And of course, as a nation, what we're doing is we've changed from 3 square meals a day into 7 to 10 snack attacks a day. And that's really bad news for our teeth. Our teeth need about an hour for the saliva to restore the acid balance in the mouth after we have sugary foods and drinks. We simply don't give them that anymore. We're constantly grazing on things.
And there's some scary things we put in our mouths out there that you don't really think much of, whether it be fruit juice, soft drinks, crisps even apparently are quite bad.
Crisps not too bad. They don't really cause decay, but
they stick between your teeth.
They can stick in between your teeth. But the fruit juice and drinks that people think are healthy, high in acid, or can also be high in sugar. And we're seeing in this country a great increase in dental erosion in children. So that's really a great cause of concern. Interestingly, although the American kids have far more fizzy drinks, we see more erosion over in Europe.
Yeah. Now, there's another couple of problems, of course. That is an access to a dentist and the cost of dentistry.
Access, I think, has got a lot better. Really, you should be able to find an NHS dentist now if you want one. 2 or 3 months left to contact your primary care trust before it moves to the National Commissioning Board, but there is an ample supply of dentists now.
So there are enough dentists for everybody who wants to get an NHS dentist?
Everybody who wants a dentist should be able to find an NHS dentist, and your PCT will actually help you to do that. But certainly there are problems in terms of costs. In the survey, we surveyed 175 dentists, and they felt that cost was a barrier to nearly 90% of their patients, and that really is significant. But I think the message that we should get across there is you do need to go on a regular basis. If you go regularly, then the costs are actually going to be less because you're going to need less doing. If you store things up, that's when you're going to get the high costs.
And it is, I mean, you're investing in your health. I mean, it could be a false economy for many people. And for people watching today, and if they could do just one thing or 2 things to improve their overall oral hygiene and their chances of their teeth preserving for a lot longer, what would you say to them?
3, if I can have
3. 3, okay, yeah.
Brush twice a day, 2 minutes at a time with a fluoride toothpaste. Cut down on the frequency of sugary foods and drinks. It's the frequency rather than the quantity.
Yes.
Think about keeping clean on the go, using sugar-free gum, and visit the dentist regularly. Take their recommendation. We don't necessarily say these days every 6 months, but as often as your dentist recommends.
Do you think people are more concerned with the look of their teeth rather than the state of their teeth?
That's certainly a problem, and we've become a sort of celebrity-obsessed culture. And that can be, again, the dentist there felt that the sort of passion for white teeth and so on was not necessarily a good thing and was coming at the expense of some of the basic messages around oral health. We look for a quick fix these days, and with oral care, most of the oral care is not done in the dental surgery, it's done by yourself at home. So it really is keeping up that good oral health routine
Just
on a
a
day-by-day
final
basis.
point. I was talking to some dentists recently, and they were talking about it's very, very difficult apparently to recruit dental nurses. And part of this is to do with the obsession to get people to do degrees and things, that there's a whole generation of people who would have gone into dental nursing who are now not doing that. Is that true?
Well, we're not up at degree level yet with dental nursing, but certainly now you have to be registered as a dental nurse, so you certainly have to qualify as a dental nurse or be in training.
But I'm
to
saying
work in
maybe
a
people who
practice.
would have been enticed into the profession are now being encouraged to go elsewhere.
I think that's been a problem over a number of years. There have been various barriers put in the way of people going into dental nursing over the years, and what we're really looking for is somebody who can carry out the routines well and also support and be kind to the patients.
Excellent. Dr. Carter, thank you very much indeed. Dr. Nigel Carter is the Chief Executive of the British Dental Health Foundation. Thank you very much indeed. We're going to take a break. Special guest right after that, a woman...